March is Save Your Vision Month, so in today's You Ask, We Answer, we've invited Dr. Pamela Lowe to answer your question. She's an optometrist and the director of the Professional Eye Care Center on North Milwaukee Avenue. Good morning, doctor.
Good morning.
Let's take a look at our first question from Orga. She says, I have multiple sclerosis and it has attacked my eyes, making me blind more and more every day. Is it correctable, or will I go completely blind?
Well, multiple sclerosis is a disease of the central nervous system, and it does affect the optic nerve. It causes a swelling of the optic nerve, which we call an optic neuritis. Now, it's extremely rare that optic neuritis would affect both eyes at the same time, and even rarer that would cause complete vision loss. Patients usually present with vision loss in one eye that progressively gets worse over a few days, and then over a course of 4 to 12 weeks, it will get better and better.
Okay.
So again, it is rare that it causes complete vision loss. There's doctors of optometry called low vision specialists that can help if vision loss is worse.
Great. Our next question is from Peggy of Chicago. Let's see. I believe we have her on tape. Do we have her?
My son was prescribed glasses at age 10 and doesn't seem to need them anymore, and I wonder if your eyes improve as you get older.
Ah.
Well, that's a very good question. It's not uncommon for young children to have a condition called hyperopia, and hyperopia has to do with the eyeball being a little shorter in length, which causes the focusing system of the eye to have to work harder. We prescribe eyeglasses to take eye strain off the eye. Now, as the child grows, their eye can grow a little bit too, and the farsightedness does go away, so the child will not need glasses at a certain point.
Our next question is from Laura on the north side. I've had lazy eye on my left eye for a few years now, and the optometrist prescribed eyeglasses for me. A different doctor told me that the eyeglasses were not going to help and said I needed visual therapy. Who is right?
Well, this is an interesting question because actually both doctors can be right. Amblyopia is a condition or what patients term lazy eye, where one eye is capable of good vision and one eye is not. And usually that happens early on in childhood where the visual pathway to the brain doesn't develop properly. So we used to think that you had to treat patients early on, but there's evidence that shows at any age amblyopia therapy can be effective, and a combination of eyeglasses along with vision therapy can be effective for patients.
Okay, our next question is from Rosalie of Chicago.
I'm having problems, especially with my right eye watering more than I would like it to, and I would like to know what to do about it.
What causes that?
Well, this sounds funny, but usually an eye will water because it's dry. And what we do in dry eye is actually treat what is causing the dry eye. Sometimes it's just due to the patient needing extra lubricants that we use eye drops or eye gels for, or sometimes they need to use a special shampoo on the eye to help the oil glands that produce the oil layer of the tear not let the tears evaporate as quickly as possible. But the eye doctor needs to evaluate you and decide what treatment is best.
Okay, our next question is from Barbara of Chicago.
What are the latest developments with bifocal contact lenses?
Boy, these bifocals.
Right. Well, you know, the contact lens industry has just had a technology boom, especially in the past 10 years, just like the country has had a boom. Contacts for bifocals are still a difficult thing to correct a patient's eye with, but we're making advances more and more. The latest contact lens for presbyopia or needing bifocals is a lens that you would throw away every day, and that might be great for some patients.
Okay, and our next question is from Joe Steiner of Chicago.
My left eye can see farther than my right eye, and I want to know why it is.
Well done, Joe. Okay.
Well, sometimes you'll have an eye that's just a little nearsighted, and glasses can correct that eye and make it an equal vision with the other. But sometimes you'll just have one eye that's more dominant than the other, even though you have good vision in both. Just like you have one hand that's more dominant than another hand. So you could check which eye is dominant by just putting a camera up to your eye, and whichever eye you choose usually will be your dominant eye.
What is your opinion on LASIK surgery? Everybody says it's great and how successful it is, but they haven't been doing it that long. That perhaps if there was a problem, perhaps you would not have discovered it by now.
Right. Well, LASIK in the United States has been done going on 10 years, and usually we get all our studies and no more long-term effects at that 10-year point.
Okay. Okay.
It is an effective treatment, but with any surgical procedure, there are risks. So depending on your eye health, there can be certain risk factors that are greater for one patient compared to another.
So that's interesting. 10 years is usually the time
Usually
frame.
that's when we like to get more of our studies in so we could see more long-term effects.
Okay. Excellent. Well, Dr. Lowe, thank you for joining us this morning.